Cameron.
Hey, how's it going?
Good. My name's Becky. I'm going to be your occupational therapist today.
Great.
I understand that you have, the doctor said you have some lateral epicondylitis, so you're feeling some tenderness and pain in your right elbow. Is that right?
That's true. Yeah.
Okay. I know we already went over your contraindications and your sensation and skin integrity looks great. So this video will help you actually be able to do the ice massage at home. So we'll go over the steps so that this can kind of just be another aid for you to, just in case you forget or need a reminder, and walk you through the steps of how to actually do ice massage, which you said you're okay with doing today.
Yeah,
okay.
That'll be awesome.
Okay, great. So I know you're a truck driver and you're using your elbow a lot.
All the time.
Yes. So this will be great to actually help reduce the pain that you feel sometimes when you've been, driving for long hours. And something that you can do at home or on the road. It's really simple. All you have to do is you'll just need a Dixie cup.
Okay.
And you can fill that up. I usually like to fill it up pretty close to the top, and then you'll freeze it. And once it's frozen, you have your ice massage ready to go.
Okay.
Sounds
Sounds pretty easy.
Yeah, and the handout I'll give you also has all this information too. So this is just another aid to help you out. And the one thing about ice massage is it is really cold. So something that could happen is you can get frostbite if the ice is applied for too long, but I don't expect that to happen today. We're going to monitor you going through the different stages of coldness, burning, aching, and numbness. So we will not experience frostbite today, but that is something that is at a risk for you.
Okay. Good to know.
So we'll go ahead and get started. Perfect. So your arms elevated. Are you comfortable there?
Yep. That's perfect.
Great. So with the ice massage, we kind of talked about it, but you're going to feel four sensations: coldness, burning, aching, and numbness. And you should first go through coldness and then burning, aching, and numbness. But sometimes people will skip through the steps. So we'll just be in constant communication to make sure that we're monitoring the steps that you're going through. And it's important because if you feel anything other than those sensations, I want to know. And then also when we get to the end, when we get to numbness, it means our treatment's done.
Okay.
We don't want to go beyond that. Okay, so told you how to actually make these little ice cups. And what you want to do is once you have the ice frozen, you can just go ahead and tear down the edges of the ice cup. And then the ice is exposed, but you want to go ahead and just use your palm of your hand to smooth out the edges so that you don't end up cutting your skin. And once they're nice and smooth,
my skin look in good condition to
yes, your skin looks great. You have good skin integrity. We checked your sensation, and you don't have any health complications or contraindications that would be counterproductive to actually doing ice massage.
Okay, perfect.
So looks great. So I'm going to go ahead and apply the ice. So it will feel cold. So you'll start to feel your first sensation.
That is the first sensation.
You're feeling it?
I am feeling cold.
And when you're doing this at home, you can just go ahead and apply the ice in small circles. And you want to kind of avoid any like pokey spots where your bone is poking out, because then you're not really getting to the part that you want to help make better.
Okay. So I want it on the muscle, I guess.
Yeah.
More of the muscle.
Exactly. Yeah.
Okay.
So you can just go ahead and go around in little circles.
Yep. I'm starting to feel the burning.
Burning. Okay. Good. That's good. So we're moving into the next stage. And once you get into that aching, you feeling the aching yet?
Close to aching, yeah. I am aching right now.
It is slightly.
I think I'm very close to being numb. So
okay, sure, yeah. Just let me know.
15 to 20 more seconds.
You think you'll feel numb? Okay, good. And then once we get to numbness, our treatment will be done, and hopefully you should feel some reduction in pain, and it'll help you get back to doing the things that you want to be able to do, like driving and being able to perform your job.
Perfect.
Let me know when you get to that. You said you're now past.
I think I'm there.
You're at numbness.
I can't feel the circles anymore.
Can't feel it? Okay, perfect. So we'll go ahead and stop.
Okay.
Great. And how does it feel? Your skin looks like it's a little pink, and that's normal.
Okay.
It should go down after a few minutes, but it's normal for it to be in contact with ice to actually be a little bit pink right now.
Okay.
Do you feel okay?
Yeah, I feel fine.
Okay. And when you're actually moving your arm, feel a reduction in that pain, not as painful as it was before?
Yeah, it's a little numb, but yeah,
I
definitely feel
good.
A reduction right now.
Good. And so that's the whole point of ice massage. So hopefully this video will help you go ahead and take these practices home. And of course, if you have any other questions while you're doing this at home for your next treatment, come in, write them down, and ask me, and we can definitely think about other modalities that might work for your lateral epicondylitis, but this seems to be what you said, reducing your pain, so that's great.
Perfect. This is great.
Okay, good. Well, it was great
All right.
working with you.
Thank you very much.
All right.
All right.